Hello everyone, I am Dr. Sahithi Balmuri, Consultant Obstetrician Gynaecologist at KIMS Hospitals, Gachibowli. Today we are here to talk about cervical cancer and its prevention strategies. First of all, what is cervical cancer? Cervical cancer is nothing but the cancer of the cervix. Cervix is the mouth of the uterus. The lowermost part of the uterus is known as cervix, and the cancer arising from this area is known as cervical cancer. Why about cervical cancer? Because cervical cancer is the leading cause of women in India due to cancer related deaths. Yet, do you know it's completely preventable and treatable? Most women are not identified in the early stages, and hence the cancer progresses to final stages at the time of diagnosis, leading to a bad prognosis. So, who are at risk for getting cervical cancer? Women who had early childbirth, early age at the first intercourse, multiple sexual partners, or recurrent cervical infections and unhygienic practices, especially unhygienic menstrual practices. These women are at high risk for cervical cancer. What happens here is the cells in the cervix area undergo changes due to multiple trauma, which slowly leads to cancer. But let me tell you, this cancer does not develop in a day. It takes a minimum of 5 to 10 years for this cancer to develop. This is where prevention strategies take place. Now, if you're able to identify the cancer at an early stage or in a precancerous stage, it is completely curable too. What are the types and prevention strategies? Let's discuss that further. So, there is a test known as pap smear, as most of you have heard. This is a test which detects the cancer in these cervical cells. It's a very simple OPD test which has to be done in all women aged 35 and above once their reproductive and sexual life is started. And it needs to be done once every 3 years. It's an OPD procedure where the gynecologist will check the internal examination and do a smear test from this area and send it for reading under the microscope. This test identifies if there are any precancerous lesions or cancerous lesions in the cervix, which will enable a quicker treatment. Now, this is only for identification, but did you know there is a complete prevention too? That is nothing but your HPV vaccination. HPV vaccination is ideally to be given to girls and boys between the ages of 9 to 15 years, where only 2 doses are required. But don't worry, if you've missed that age also, the vaccine can be taken up to the age of 40 years, but 3 doses have to be taken. Consult your gynecologist to know more.